acetaminophen, and ibuprofen. People have asked why. Why would we start carrying oral medications on ambulances? And the answer is because they're really helpful in the care of our patients. These medications that we've chosen are both antipyretics or fever-reducing medication, as well as analgesics or pain medications. And both of these medications will make people feel better in these indications. Both come as liquids, and that's important because we don't want to carry pills on board an ambulance and need to carry additional liquids for patients to swallow the pills with. Both offer limited risk, and both may be given together so that synergistically they can have a better effect for our patients. Indications for oral medications in general. First, mild conditions that we don't expect will need surgery. EMS providers won't always know which patients will or will not require surgery, but some examples: severe abdominal pain or open fractures are both cases where patients will very likely need surgical intervention. In those cases, for anesthesia, we like to make sure the patient has had limited things by mouth. The patient must be able to swallow. They must be able to swallow easily. If they can't sit up and swallow safely, they won't be able to take these medications. Contraindications? Well, these are just the opposites, really. First, the anticipated need for surgery. Second is the inability to lie flat and the inability to swallow. Also important to remember, if someone says they have an allergy to the medicines, they can't have them. First medicine, acetaminophen, also known as Tylenol. Indications: mild to moderate pain or fever, and analgesia for patients who are declining opioids. Tylenol is actually a great analgesic. Contraindications: liver disease, things like hepatitis and cirrhosis. These are reasons that patients should not get acetaminophen. It's supplied 160 milligrams in 5 mLs, and the dose is 15 milligrams per kilogram up to the adult dose of 650 milligrams. And the adult dose will be 20 milliliters of medication. Ibuprofen, also known as Motrin or Advil. Indications: mild to moderate pain or fever. It's analgesia also in patients who are declining opioids, and ibuprofen, frankly, is also an excellent analgesic. Contraindications: kidney disease. So if the patient is on dialysis or have known poor kidney function, or if this is a patient with a history of a kidney transplant, they should not get ibuprofen. Also, if the patient has ulcer disease or prior gastric surgery, and if they have an active GI bleed, they should not get ibuprofen. If they're on Coumadin or warfarin, they should not get ibuprofen. It's supplied 100 milligrams in 5 mLs. The dose is 10 milligrams per kilogram up to 400 milligrams. And the adult dose is 20 milliliters. A few key points as we close. First, these are great medications for us to add to the formulary. But these are not going to be required medications at this point. These are actually going to be if equipped and trained. So if an agency or a region chooses not to implement ibuprofen or acetaminophen, they can choose to do that. Our suggestion, our strong suggestion, is that these be administered using either medication cups or oral syringes if available. That'll keep things from becoming confusing in terms of what kind of syringe is being used, and will make it a little bit easier for patients to actually take the medication. Always shake these medications prior to administration, because shaking them allows the active ingredients to be in suspension appropriately, so the patient gets the dose that you intend. And the last thing that's extremely important, and I cannot overstate this, that if the patient has an IV, you must absolutely be as vigilant as possible. These medications may not be given intravenously. So you've got to be really, really careful that if that medication is in a syringe, that syringe is handed to the patient and goes into their mouth and does not get injected into the IV. So, bottom line, these are great drugs. Use them for the right indications. This is excellent patient care, and be careful. As always, thank you very much.